It's important to know the difference between removable prosthodontics and fixed prosthodontics. In this chapter, we're going to be discussing removable prosthodontics, and know that that's going to be any kind of appliance that's going to have to be removed from the mouth. So the patient's going to have to remove it in order to clean it. So there's going to be different types of prosthesis involved when it comes to removable. There's a lot of different appliances available, and it's going to depend on how many teeth the patient has remaining. So first one is going to be the partial. And the partial, as you can see, is replacing some missing teeth. Partials are designed typically to replace definitely posterior teeth, just because with the framework of the metal, it's going to provide stability and strength. We're going to talk about another appliance here as to why it's not good for using in posterior, but partials used to replace some missing teeth can include posterior and also anterior, depending on how many teeth the patient is missing. With a partial, we always have to make sure that the remaining teeth that are present are in a really good shape, because this again is going to be taken in and out constantly. So we don't want to, as a patient's taking this out, we don't want to have a tooth be loose as they're trying to do it, because it's going to damage those teeth over time and could eventually even extract the tooth as they're trying to take this out. There's different things on the partial that we'll discuss in a different video as far as what those components are that helps to keep the appliance in the patient's mouth. But again, healthy teeth, remaining teeth must be present in order for a partial to be considered as an option for a patient. The other type of prosthesis is going to be the denture. This is a full denture. It's replacing all missing teeth. If a patient maybe is missing a few teeth and the remaining teeth are in poor condition, then at that point they're not going to be a candidate for a partial, because again, those remaining teeth being in the shape that they aren't going to be able to withstand this constantly coming in and out. So the dentist might opt to have the patient extract the remaining teeth and then create a upper denture or lower denture, depending on what it is. It's a lot easier for patients to get used to an upper denture than it is a lower denture, because you can see the way it's made. It has the full palate up here as it's inserted into the mouth. That palate, the acrylic on the palate allows for the suction of the palate in the mouth to basically keep it in place. There's a lot of times that the suction is pretty strong, that it's hard and difficult for the patient to get it out. So maneuvering it is going to definitely be a challenge and something they're going to have to practice with. But if a patient's going to have any kind of a denture, it's always best to have an upper, just because of the suction from the palate that helps to keep it in. The lower denture, as you can see, is just basically has kind of, you can kind of hopefully see this, kind of a ridge in here. And when they take the impression, that's how they are able to create the dentures so that they're going to fit accurately. So the lower denture is just basically going to fit into the ridge that's remaining after the teeth have been extracted. And we oftentimes call the lower dentures floaters, because especially if a patient doesn't have a deep enough ridge to accommodate a denture, what tends to happen is it moves. Patients definitely are going to have to learn to use their cheek muscles as well as their tongue to help keep it in place. But usually for lower dentures, we recommend patients use some sort of adhesive in there, again, just to help kind of keep it in place as it's sitting down onto that ridge. So upper denture, lower denture, that's what they look like, as opposed to a partial. So in this patient is missing on the right hand side just the first and second molar. So they have their premolars and their anterior teeth, canines. On the left-hand side, this patient is missing both their first and second premolar as well as first and second molar that this is replacing. So in this patient, the only teeth that they have remaining are primarily anterior teeth, which still allows them to be able to function and eat appropriately. Another type of appliance that you need to be aware of as far as a removable appliance is going to be something like this. This is considered to be a flipper. It is also removable, as you can see. And unlike the partial, flippers are designed primarily for anterior teeth. So your centrals, your laterals, your canines, you don't want to go to posterior teeth just because of the way these are designed. This is just all acrylic. There is no metal other than maybe the clasps that might be designed onto them to help keep it in place. But other than that, this isn't going to be have the strength to be able to withstand the chewing forces like a partial would be able to do because the framework that's surrounding it. Here's a kind of one that's stripped down without the teeth, so you can kind of get a sense for what the framework looks like. And then they create and develop, they put the acrylic over this along with the teeth, again, to kind of make it look a little bit more natural in the mouth. But this framework here provides the stability needed for the strength of the chewing that's going to take place. These flippers are not going to be designed in that manner, so usually to replace anterior teeth only, and they're only meant to be temporary. You will find that you will have patients that will come in with a flipper that they've had for years. You know, kudos to them. These are not meant to last for a very long time. So, you know, kind of keep that in mind. And as we're talking with the patients, we do want to let them know that they are meant to be more of a temporary thing to allow for healing to take place, because as you know, when a tooth is removed from the socket, it heals from the bottom up, and the tissue, gum tissue and bone tends to somewhat recede a little bit. So if we were to do something more permanent like a bridge or an implant with a crown, more than likely, as that patient heals, there's going to be a gap between the fixed appliance and the gum tissue because that socket healed up and shrunk. So this is meant to be kind of more for the healing process for the patient, or kind of an immediate thing if a patient either has a tooth knocked out or we need to extract a tooth for whatever reason, then this is something, again, a lot of people don't want to be walking around with, especially a missing front tooth, that this is kind of gives them that still that aesthetic of having a tooth in the mouth, but again, meant more as a temporary type of thing. We call them flippers for a reason because even though they do have clasps, some of them, they don't stay in the mouth very well. I always told my patients that these were more for show than function. So trying to bite an apple with these or chewing steak is going to be very difficult, and they run the risk of breaking these just because they're not very strong. So I would kind of tell them if they're going to be eating in a place where they're able to remove it, to go ahead and do so. So that way they don't take the chance of it breaking. So flipper, more of a temporary, replacing anterior teeth, 1 to 2 only. Dentures, replacing all missing teeth. And partials, replacing some missing teeth. One thing I do want to make note of on both the partial and the denture is you notice that on both the partial and the denture, on the lower as well for the denture, all you see are the first and second molars. Third molars are not added onto the partial or the denture. There is no need for the third molars. Having the first and second is going to be sufficient enough. So just know that third molars are not added onto dentures or partials.